class. My name is Shayna Perez, and I will be doing my presentation on schizophrenia spectrum disorders. What is schizophrenia? Schizophrenia is a chronic brain disorder that affects less than 1% of the U.S. population. When schizophrenia is active, symptoms can turn into hallucinations, disorganized speech, trouble with thinking, and motivation. Schizophrenia causes a disconnect from reality and affects the patient's ability to realize their own symptoms. It is a very severe condition, but is treatable and manageable. What are the different types of schizophrenia? Schizotypal personality disorder also falls under the personality disorder. Delusional disorder, brief psychotic disorder, schizophreniform disorder, and schizoaffective disorder. Psychiatrists once referred to the different types of schizophrenia like paranoia or catatonic schizophrenia. However, experts no longer use these terms in diagnosing. They are more so used to describe symptoms. Schizophreniform disorder is a short-term mental health condition that causes psychosis. It lasts longer than 1 month but shorter than 6 months. Schizoaffective disorder is a combination of schizophrenia and mood disorder. People with this may experience depression, mania, and psychosis. Who does it affect? Men ages 15 to 25, women ages 25 to 35. 20% of cases start over the age of 45. Majority of the cases are male. And childhood schizophrenia is extremely rare and considered when diagnosed under the age of 13. Although childhood schizophrenia is rare, it is possible to have. Childhood schizophrenia is very severe and hard to treat. Only about 1 in 10,000 have this.
I really like Pokemon. As you know, I like Pokemon. My favorite Pokemon I have is my Froakie and my Pikachu and my Bulbasaur.
Yeah.
And I love music. And I love to dance.
Is there a particular song you like right now?
I like Tonight's Gonna Be a Good Night by Black Eyed Peas.
We noticed that you took a little medicine. Do you know what the medicine's for?
Oh, it just helps me, it helps me do a lot of stuff. I can't really tell you that, but it helps me do a lot of stuff. And I'm happy to be on TV today.
You like being on TV?
Yes, I've never been on TV. And as you can see, my dog, he needs to be trained, and I'm kind of working on focus stuff at my school.
We're talking about your mental illness. Do you know about that?
Oh, my mental illness?
Mm-hmm.
It's kind of weird. There's a lot of things that happen to me in my life. I may not explain all of this tonight, so.
Do you understand what it is?
A mental illness?
Mm-hmm.
Oh, and a mental illness is when you're like this. Like you either have Asperger's, maybe, or you have maybe autism.
Do you know what you have?
I have bipolar.
How do you feel?
Well, sometimes I feel happy or mad or a little bit emotional.
Yeah.
And I love to spend money.
Do you understand when you feel mad that sometimes that's a little scary for you?
It scares my sisters a little bit, but they always forgive me. If you're being bullied, well, what I do is I just walk away and say whatever.
Yeah. Do you sometimes, when you feel sad, do you sometimes
I punch a punching bag. Yeah.
Yeah? You play basketball too?
Yeah, I got my 2 hoops today.
Do you know that sometimes your parents worry about you and they're sad?
Yeah, I
Do you hear voices?
know. Yeah, more of vision. Sometimes I think about stuffed animals or other things. Sometimes it's bad. It scared the heck crap out of me. When I got home, voices came in my head. So I just told Mom, and I couldn't even listen to my music.
When you say voices were in your head, do you remember what they were telling you?
I actually, when I had voices, I don't remember most. I don't remember a lot of them.
Are they friendly? Are they nice?
No, they're not friendly. Sometimes no. Sometimes they're not. They're just not friendly.
You want them to go away?
They already gone away.
They've gone away. Thank you.
And this interview is done.
Okay, well done.
I really like Pokemon.
The 5 symptoms of schizophrenia are delusions, which are false beliefs that people can hold even with plenty of evidence of them being wrong. Hallucinations, which is when people think they can smell, hear, see, or touch things that are not actually there. Disorganized speaking, which is trouble organizing thoughts while speaking, trouble staying on topic, or thoughts being so jumbled that people have a hard time understanding. Disorganized movements. People might move differently than other people around them, may turn around for no reason, or have no movement at all. Negative symptoms is the loss of the ability to do things as expected. Many people with schizophrenia can't recognize their symptoms, but usually those around them can. People will notice others speaking in a flat tone, emotionless voice. The symptoms also include a lack of motivation or not wanting to socialize in activities. People may feel paranoia, fail to care for hygiene or appearance, and use recreational drugs or alcohol to cope with their symptoms.
Schizophrenia was first identified more than a century ago, but we still don't know its exact causes. It remains one of the most misunderstood and stigmatized illnesses today. So let's walk through what we do know, from symptoms to causes and treatments. Schizophrenia is considered a syndrome, which means it may encompass a number of related disorders that have similar symptoms but varying causes. Every person with schizophrenia has slightly different symptoms, and the first signs can be easy to miss. Subtle personality changes, irritability, or a gradual encroachment of unusual thoughts. Patients are usually diagnosed after the onset of psychosis, which typically occurs in the late teens or early 20s for men and the late 20s or early 30s for women. A first psychotic episode can feature delusions, hallucinations, and disordered speech and behavior. These are called positive symptoms, meaning they occur in people with schizophrenia but not in the general population. It's a common misperception that people with schizophrenia have multiple personalities, but these symptoms indicate a disruption of thought processes rather than the manifestation of another personality. Schizophrenia also has negative symptoms. These are qualities that are reduced in people with schizophrenia, such as motivation, expression of emotion, or speech. There are cognitive symptoms as well, like difficulty concentrating, remembering information, and making decisions. So what causes the onset of psychosis? There likely isn't one single cause, but a combination of genetic and environmental risk factors that contribute. Schizophrenia has some of the strongest genetic links of any psychiatric illness. Though about 1% of people have schizophrenia, children or siblings of people with schizophrenia are 10 times likelier to develop the disease, and an identical twin of someone with schizophrenia has a 40% chance of being affected. Often, immediate relatives of people with schizophrenia exhibit milder versions of traits associated with the disorder, but not to an extent that requires treatment. Multiple genes almost certainly play a role, but we don't know how many or which ones. Environmental factors like exposure to certain viruses in early infancy might increase the chance that someone will develop schizophrenia, and use of some drugs, including marijuana, may trigger the onset of psychosis in highly susceptible individuals. These factors don't affect everyone the same way. For those with very low genetic risk, no amount of exposure to environmental risk factors will lead them to develop schizophrenia. For those with very high risk, moderate additional risk might tip the balance. The antipsychotic drugs used to treat schizophrenia have helped researchers work backwards to trace signatures of the disorder in the brain. Traditional antipsychotics block dopamine receptors. They can be very effective in reducing positive symptoms, which are linked to an excess of dopamine in particular brain pathways. But the same drugs can make negative symptoms worse, and we've found that negative symptoms of schizophrenia may be tied to too little dopamine in other brain areas. Some people with schizophrenia show a loss of neural tissue, and it's unclear whether this atrophy is a result of the disease itself or drug-induced suppression of signaling. Fortunately, newer generations of antipsychotics aim to address some of these issues by targeting multiple neurotransmitters, like serotonin, in addition to dopamine. It's clear that no one transmitter system is responsible for all symptoms, and because these drugs affect signaling throughout the brain and body, they can have other side effects like weight gain. In spite of these complications, antipsychotics can be very effective, especially when combined with other interventions like cognitive behavioral therapy. Electroconvulsive therapy, though it provides relatively short-lived relief, is also re-emerging as an effective treatment, especially when other options have failed. Early intervention is also extremely important. After months or years of untreated psychosis, certain psychoses can become embedded in someone's personality. And yet, the dehumanizing stigma attached to this diagnosis can prevent people from seeking help. People with schizophrenia are often perceived as dangerous, but are actually much more likely to be the victims of violence than the perpetrators. And proper treatment may help reduce the likelihood of violence associated with schizophrenia. That's why education for patients, their families, and their communities helps erode the stigma and improves access to treatment. Continue to educate yourself about the symptoms, causes, and treatments of different mental health conditions with this playlist.
The diagnosis and tests for schizophrenia. A healthcare provider can help diagnose with a series of questions. Using the DMS-5, the following criteria needs to be met. 2 of the 5 main symptoms, symptoms persisting for more than 1 month, inhabilitate the ability to work or have a relationship with friends and family. And the tests include imaging tests, blood, urine, and cerebral fluid tests, a spinal tap, and the electrocephalogram, EEG. Imaging tests such as CT or MRI to rule out possibilities of tumor, stroke, or brain injury. The blood, urine, and spinal tap are looking for chemical imbalances within the body that could explain the changes in behavior to possibly rule out heavy metal toxicity, poisoning, or infections. And the EEG will look at the brainwave activity that can help rule out epilepsy in the patient. Treatments. Is schizophrenia curable? It is not curable, but it's treatable and able to be managed. In some cases, people can recover entirely and manage it throughout their lives. Usually treated with a combination of medications, therapy, and self-management techniques. Medications include first and second generation antipsychotics and next generation antipsychotics. Psychotherapy using talk methods like CBT, cognitive behavioral therapy, or electroconvulsive therapy, ECT. There is no cure because there is no prediction on who will relapse and who will not, so the illness is considered to be treatable with management. The first and second generation antipsychotics block how your brain uses certain chemicals for cell-to-cell communication. Next generation antipsychotics were recently approved by the FDA that act on cholinergic receptors other than dopamine receptors. And the ECT causes small shocks to help with the brain function. Stimulation causes small seizures to the part of the brain. The patients will be put under anesthesia to help with the pain during the procedure. And that concludes my presentation on schizophrenia.